Neonatal units in Wales are understaffed, ill-equipped and over-capacity, according to a report from the National Assembly for Wales's Health, Wellbeing and Local Government Committee. Its inquiry found that insufficient resources in the face of increasing demand are placing extreme pressure on neonatal services across Wales. The committee heard evidence of units being closed due to overcapacity and one mother and her preterm baby being separated because her baby had to be transferred to provide space for another.
We have a lack of capacity in terms of cots in the lead centres, and this affects intensive care cots and high dependency cots. You probably are aware that neonatal care is divided into different categories, with intensive care being the sickest babies. These are babies who are born perhaps very prematurely, who need support with their breathing, so they need ventilation, they may need circulatory support, and they may need a period of intensive care for several weeks.
Sonny was born 14 weeks premature. His older brother Jacob was 11 weeks early. Neither weighed more than a bag of sugar and both needed special care.
That was the dummy that they gave him to start off with, which compared to a normal dummy, if I have one, is significantly different. So as you can see, massive difference. And these are purpose-made ones purely for early babies, because part of the ventilation, they like them to have dummies. And I mean, that's the sort of size. This is a newborn, tiny, premature baby vest, but that didn't fit the children until they were at least 6 or 8 weeks old. The worst part is the lack of control, because as a parent, you think you're going to have a child and you're going to have some responsibility for it. And for the first 12 weeks on both occasions, I was waiting for people to tell me when I could do things, when I couldn't do things, hold them, touch them, care for them, do anything really. And that's really difficult. And then you may turn up to the hospital and there's twice a day when there's an avenue for you to actually be involved in doing something with a child, because the incubator's closed, nobody touches them. So you turn up maybe at 8 o'clock in the evening for a designated time to do just oral mouth washing and just a nappy changes, sorts of things, which is all you can do as a parent at that stage. But because something else has happened, it's been done early.
According to the report, the All Wales neonatal standards aren't being met and more funding is needed for this to change.
Well, obviously the birth of a child is a miraculous event that everybody and every parent should be able to enjoy, but unfortunately some babies are born with problems and need that little bit of support from the caring professions in order to make it through. Now, what we're concerned about as a committee is that during the course of our inquiry we found that that special care baby units have been understaffed, ill-equipped and simply overcapacity in terms of the amount of work that they have to do.
The committee makes 18 recommendations in the report, including urgently addressing the shortfall in medical and nursing staff to ensure services are safe, the establishment of a cot locator system to make sure services are allocated more efficiently, greater integration between neonatal and maternity services, and examine how ambulances are used on an ad hoc basis for patient transport and how that service can be improved. The full report from the Health, Wellbeing and Local Government Committee is available to view and download from the Welsh Assembly website.